Hello everyone, and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our website. We're coming to you from the University of Wisconsin Population Health Institute, and my name is Stephanie Johnson. I'm a community coach with the County Health Rankings and Roadmaps, and I'm joined by my colleague Mary Bennett.
Hello everyone, it's wonderful to have you all part of this webinar, and I'll be helping to answer your questions throughout today's webinar, as well as sending out links via the chat box throughout the webinar.
Thanks, Mary. We want to acknowledge the important relationship that we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. And this program is the result of contributions of many, many partners, including those listed here. So we'd like to take a moment to get you oriented to the technology that we're using today. The GoToWebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you'll see my screen throughout the presentation. And on the right, you'll see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. Feel free to enter your questions in the control panel at any time, and as questions pertain to the content that we're covering, we'll take a moment and pause and answer them along the way. We'll address questions outside of what we cover during Q&A toward the end of the webinar. And feel free to enter comments as we go along. Here's a look at what we're going to talk about today. We'll start with an overview of County Health Rankings and Roadmaps, and then we'll demonstrate how you can use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps Action Center can help you move forward with action and how you can learn from others. Throughout the webinar, we'll head over to countyhealthrankings.org so you see how the site functions, and you'll be able to walk away from today's webinar able to confidently navigate the site. So as we go through the webinar today, if you have an idea or a thought, maybe a tool or example you'd like to share, please feel free to enter these in the chat box, and we'll make every effort to share them with everyone on the call. Specifically, we encourage you to think about who else do you need to share this information with? What's an idea for taking action that you might be taking from this webinar today? And what else do you need to know to take action and to use the information? The Robert Wood Johnson Foundation has laid out a powerful vision for building a culture of health in every community in the country. That vision includes the belief that all individuals and families should have the means and the opportunity to make choices that lead to healthy lifestyles, regardless of where they live. So we'd like to start this webinar today with a guiding question. How can County Health Rankings and Roadmaps help us build a culture of health in every community? And this is an image that comes to us from Cambridge, Massachusetts. They had a community partnership where all of their community partners put their names on a strip of fabric, and then they weaved them into a tapestry that you see here. What I really like about this tapestry is that it visually represents the power of collaboration to bring diverse partners together to create something new, their partnership. And they did this by working with diverse partners from all walks of life. This is one of the ways Cambridge is building a culture of health. So I'd like you to think about, what does your tapestry look like, and is it helping you build a culture of health? Similarly, the County Health Rankings and Roadmaps program is made up of many, many components that work together with a common purpose, building a culture of health county by county. And as we share the various components that make up the County Health Rankings and Roadmaps, think about which piece or pieces of the program you can use. So let's start by reviewing a little bit about the County Health Rankings. This picture shows the thinking behind the rankings. It's really our theory of change about how rankings can be a catalyst for action that improves the health of everyone in the community. So we start with population-based data from a variety of sources, and we use that data to rank the health of nearly every county in every state. The rankings take several different pieces of data and really simplifies them to give communities a quick and easy snapshot of their health and of the many factors that impact how well and how long people live. Each year, the rankings release, which this year was on March 25th, generates lots of attention, national, regional, local media attention, and some of you may have even read or been quoted in stories about how your community and county compares to others in your state. This then provides an opportunity for people to tell the story of the many factors affecting health in a community. And community leaders can use the rankings to get the word out and help the community and local media help people understand the health status of their community. They use these findings as an opportunity to mobilize different sectors to look at their community's strengths and needs. And based on this deeper look, they can prioritize and identify evidence-informed strategies that can be implemented locally to make change. Over time, these evidence-informed strategies result in longer, higher quality lives for all the children and adults in the community. So essentially, the county health rankings aren't about numbers. They're really about a call to action. And the county health rankings are the starting point for discussion in communities, not an ending point. Communities will want to dig into local action to further understand what's going on and to know where and how to take action. The horizontal portion of the model underpins the rankings. The county health rankings show us that where we live matters to our health and that a broad range of factors impact how well and how long we live. And the vertical portion underpins the roadmaps. The roadmaps offers communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. So let's start with the rankings. The county health rankings ranks the health of nearly every county in every state. And for each county, you'll find two rankings. One for health outcomes, and you'll notice that's in green. We think of that as today's health. And health factors, which you see in blue, we think of that as tomorrow's health. So how healthy a county currently is in green, today's health, and how healthy a county might be in the future based on many factors that influence health. That's in blue. So this next image is really one of the most important images that we'll share with you today because it shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. So things like how we commute to work and housing conditions, quality of schools, access to jobs, access to parks, healthy foods, social connectedness, all of those impact our health. So starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors that, in turn, shape the health of communities. Many health factors, those in the blue boxes, shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And we measure two types of health outcomes, those in the green boxes, to show how healthy each county is, length of life and quality of life. So as an example, a complete streets policy that's aimed at improving the way streets are designed to encourage walking and biking can influence health factors like transit and diet and exercise, which in turn influences health outcomes. We often point to this image because it outlines what we use to determine the county health rankings and what influences health in a community. We see this as very important. What affects our health happens beyond medical care, and this image and the rankings that are based on it underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. So having looked at many factors that make up health, let's take a look at how measures are selected. We want communities to take action, so we use measures that reflect aspects of a community that can be improved. We look for measures that are valid, reliable, recognizable, and used by similar national measurements or other rankings projects. For example, many of our measures are used in America's Health Rankings, which annually measures the health of states. Our measures must be available at the county level for every county in every state, and the data we use must be available at low cost or free and as up-to-date as possible. We use fewer measures, and in 2015, 35 measures make up the health rankings because the rankings are meant to be a snapshot. This is data that is a starting point for communities. So having looked at the model and the measures, now let's take a brief look at a county example and what does it look like on our website. So for those of you who may have peeked at our website in the past, you'll notice from this screenshot that we have a different look. And I'm going to navigate over to the live site and we'll walk through some of the rankings data information. So here's a picture, here's our live website, and for the purposes of this presentation, we're going to talk about Wisconsin, and then we're going to go to Dane County because that's where we're located in Madison, Wisconsin. So you'll notice a few new things. Welcome to our homepage. And one of the things that is not really different at all is this orange navigation bar that still remains at the top of every page on our website. This is a great way for you to navigate around the full site with just a few clicks. And no matter where you are, you can always scroll up and click on the Health Rankings logo to get back to the home page. So first, let's look at the Rankings menu. From here, you can access information about our approach, the rankings data, and methods, as well as tools to help you understand and use your data. And you can also search here for your state or county. Next to that, you'll see the Roadmaps menu, and you can access tools to help you take action and learn from others. New this year is a tab for the Robert Wood Johnson Culture of Health Prize. And you'll find information on past winners, including their stories and videos, as well as the current finalists. You can also sign up for information on how you can apply for the Robert Wood Johnson Foundation Culture of Health Prize. Under the More menu, you'll find tools and resources. And these range from rankings documentation to action center tools to rankings and roadmaps presentation that you can download in your community. We also have our webinars listed here, and you can find archived webinars there. Under our About tab, you'll be able to find more information about our program, including our Roadmaps to Health coaching. So going back to our homepage, in the middle of the page, you'll find a map of the United States and a search box where you can enter your county or state name here. I'd like to highlight two new features of our homepage. One is located below our map, which is a measured detail drop-down. You can also search for your county snapshot in the main navigation bar at the top of the page here. But we're going to click on the map and start to explore the rankings. So I'm going to click on Wisconsin and walk you through this page. So this is our state overview page, and it shows both your health outcomes map, which is in green, and the health factors map, which is in blue. From this page, you can download data I'm just going to scroll a bit so you can find this along with me. You can download data, you can find more data resources for your state, and you can also browse community health improvement resources here. You'll find stories for your state, and you can also link here to the Action Center. And I'm going to talk about the Action Center in just a bit. From your state page, you can either select your county from the drop-down menu. Let me just scroll back up so you can find that. That's here. Or you can click on the county inside the map. So I'm going to click on Dane County, and this brings you to your county snapshot. So across the top of the snapshot, you see a number of tabs. Right now we're on the Rankings tab. And these tabs offer you another way to explore your data. You can explore the measures, you can get to downloads for your state, you can also compare counties when you're maybe comparing multiple counties and don't want to toggle back and forth between counties. You can use the Compare Counties feature. So let's walk through your county snapshot so you can learn a little bit more about what you'll find here. In the first column, we have the measures, and we have 35 measures in 2015. You'll find 2 overall ranks. Your health outcomes rank, again, picture of today's health, and then health factors rank, again, picture of tomorrow's health. You'll also find ranks for each health outcome. Here we have length of life and then quality of life, and then the health factor measures follow underneath the health factors tab. Your snapshot contains 4 columns of data. In your first column, you're going to find your county data. So here we see data specific to Dane County. Next, we've included trend graphs. And we include trend graphs for the 12 measures where sufficient trend graph data is available. You can see a detailed graph of the trend data by clicking on the graph icons. We've color-coded each of the icons for you to help you see kind of in a nice visual whether your county's estimate is increasing, decreasing, or staying the same over time. So if you see a red trend graph, that indicates your county is getting worse for this measure. If you see a yellow line, your county is staying the same. And if you're seeing a green trend graph, that indicates your county is getting better for this measure. So let's take a look at what a trend graph might look like. And I'm going to look at children in poverty, which is under the social and economic factors. So I'm going to click on this, and what you'll see is a trend graph for Dane County, where the the blue trend line is for Dane County specifically, the state is in green, and the national trend is in orange. The next column is our error margin, and this is an error margin that indicates we're using a 95% confidence interval, which means we're 95% sure that the actual number for your county is in the given range in that column. In the fourth column, you see top U.S. performers. So one way I think of looking at this is only 10% of counties in the nation have a better value than what is listed on your county snapshot in that column. And then finally, you see your state column, and this allows you to compare your county's number to your state overall. There's also a feature that allows you to highlight potential challenges, and this is the Areas to Explore feature. So if you turn that on, you'll notice as I scroll down a bit that some of the measures are now highlighted in orange boxes. And these are areas that you may want to explore based on health factor measures that seem to have the greatest opportunity for improvement. And then your snapshot also includes additional measures, which provides you with some additional data that may be helpful to you, but is not used to calculate the rankings. So you may have noticed, especially if any of you listened to the Methods and Measures webinar, or maybe the What You Need to Know About Rankings webinar that we did for our state teams, that there's one new measure, and one new measure has replaced a previous measure. So let me talk about that for a bit. The income inequality measure is new this year, and this measure is going to join children in poverty as a measure of income in counties. This measure has been added due to the growing understanding that not only the average level of income in a county is important, but also the distribution of that income among households in a county. So our measure of income inequality is the ratio of household income at the 80th percentile to income at the 20th percentile. A higher income inequality ratio indicates a greater division or a larger gap between the top and bottom ends of the income spectrum. We also have a measure for social and community support that's changed. The new one is called social associations, and this looks at the number of civic groups or membership associations that people can join in a county. So you can learn about these new measures on the Methods and Measure webinar, and Miri will be chatting out a link to that information. She already did. So if you would like to learn more about those particular measures, check out that Rankings, Measures, and Methods webinar. So let's take a closer look at a particular measure. You can learn more about our measures. I'm just going to scroll up to the top of this page again by clicking on the Measures tab or by clicking on the measure name from the snapshot. And I'm going to click on Children in Poverty since we took a look at that trend graph. And let's take a peek a little further about this particular measure. We've now landed on the measure detail page for Children in Poverty. And the first thing I want to point out is that the map for this individual measure, the maps in general for the individual measures have changed. In previous years, they were quartile maps, just like the maps that I showed you earlier for health outcomes and health factors. However, this year, to better highlight the magnitude of differences within states, we are using the distribution of underlying values rather than groups with equal numbers of counties to display more of that spectrum of values in the state. So you'll see in the map that the counties with particularly poor health values are colored a deeper shade, blue or green, and counties with particularly good health values are colored a lighter shade. So once again, you'll see that we've progressed along the top of the tabs, and we have a new set of tabs specific to the measure detail page. So here are the measure-specific tabs, and from these you can look at detailed data for this measure. You can see the full description, including why we use this measure, and then learn more about the data source and begin to browse through relevant evidence-informed policies and programs from our What Works for Health database. To the left, you'll see a brief description, a bit about the rankings methodology, and then some summary information for that measure. You can navigate to other measures from here as well using the orange box in the corner here. So we've also included some tools on our site to help you understand your rankings data and to think about how you can measure your community's progress over time. So again, going to our navigation bar, you can use the rankings menu to get to using the rankings data here and measuring progress. And I'm going to click on measuring progress and just point out that this is a really helpful tool that can help you better understand how to use the rankings measures and where to look for other data that can help you tell your story and help you understand how to tell if your community is poised for progress. So as you can see, countyhealthrankings.org offers lots of different ways to explore your county's data as a starting point for change. And this brings us to the roadmaps, which offers communities resources to move from awareness to action. So let's go back to our slides. So hopefully now you feel more comfortable finding and using your county snapshot, and again, kind of a reminder that the rankings and roadmaps has that ranking side, but then also the roadmaps that helps communities find strategies to impact communities' health. So how do we do this? We have created an action center for you, and from working together to evaluating your efforts, this action center provides a variety of tools and guidance to assist communities in taking action. It's an online platform that provides practical help for communities who are working collectively to improve their health, and offers guidance and tools to understand the data and strategies that communities can use to take action. So the Action Center also helps to provide access to coaches, and I'm going to go back to the website. Whoops, let me do this again. And we're going to go over to the Roadmaps to Health tab. So looking at that orange navigation bar again across the top of the page, we're going to, let's click on the logo, go back to our home page, and then we can get to the roadmaps to resources in a couple of different ways. One way is to go to that navigation bar and use the roadmaps menu, or you can access the Action Center by clicking on the Get Step-by-Step Guidance from the Action Center box. So I'm going to click on the Roadmaps to Health Action Center here and here. So you will likely notice some changes to the landing page for the Action Center. Let me scroll down to give you a better view of our Take Action cycle. So you might notice that the Take Action cycle looks a little bit different. It's really the same cycle, same steps, just a refreshed look, a little bit more of an updated look. And while all of the steps are the same, you may notice that the two steps that are overarching and happen throughout the process have moved to the outside, and that is work together and communicate. So this picture is still interactive, and if you click on any of the steps in the cycle or any of the stakeholder bubbles in the middle, you'll notice that it will take you to a guide for that step or that stakeholder. The one thing that's new that you may have noticed is we have included a navigation bar on the left with links to each of the steps and each of the stakeholder guides. So what will you find in the guides for the action step? Well, the guides describe the activities within each step and provide suggested tools and resources and additional reading. And you can start it anywhere in the cycle, either at Assess or anywhere that you may be in your own community health improvement work. So again, this is interactive. You can hover your mouse over each step, and this allows you to understand what those steps are before kind of diving into the guide. So the guides for each of the different types of people in the bubbles also explain information or shares information about the role that those stakeholders can play in improving the health of communities, along with guidance on what they can do during each step, including community members at the very center of our work. So let's take a look at one of the guides, and I'm going to click on Work Together. And once you click on that particular step, you'll find a description, the purpose, and who to involve. And you'll also notice as we scroll down, that we've broken each step down into activities so that you can find the most relevant guidance and tools for where you might be in this step. The display of these has changed, and you'll notice that we've tried to make these guides a little cleaner and easier to navigate. So when you find an activity that's of interest, you can open it and read the guidance and explore the links and related tools. So for demonstration, let's click on Recruit Diverse Stakeholders. This year we did more significant edits on 4 of the action step guides. We refreshed assess and focus, choose, and communicate. And we also tried to scale back on the amount of text and make the activities easier to read through. So for each activity, we include tools, and you'll see that on the right-hand side, to help communities work through that part of the process. You'll always see 5 tools listed, and if there are more tools, you'll see this View All Tools, and you can click on that to see if there are more tools for that activity. Also, I want to point out to look for action stories, communities and action stories that are scattered throughout the Action Center, and what works for health. And these provide great examples of programs, policies, and tools in action. For this particular step, we see a story from the United Way of Greater Toledo that explains how they used 3 of the tools in this key activity. So it brings you to a page that has more information about this particular community and how they use the tools from the Action Center. So these are intended to be quick examples that really focus on the nuts and bolts of how the work is done. Now, I'm going to use my back arrow to get back to the site where you can find these boxes over on the right-hand side. These are what we refer to as our Get Help boxes, inviting you to contact our team for personalized and free help. And this will take you to an email form that gets to one of our 11 community coaches who are based around the United States. Thanks to the support of the Robert Wood Johnson Foundation, you can be in touch with us, and one of our community coaches will be in touch with you to help you think about what your next steps might be or what tools might be of help to you. So I'm going to go back to our PowerPoint for a moment and just review a bit about how the county health rankings, again, are intended to serve as a call to action and to really ignite action in communities across the country. So this Take Action cycle is the how within county health rankings and roadmaps. We know that solving complex issues in communities, things like low high school graduation rates or excessive drinking, poor health care, these are complex challenges that require the wisdom and resources of people from all walks of life. And you'll see several potential community partners in those blue circles in the center. So at the core, like I mentioned earlier, are people working together to improve the health in a community, and we strongly believe that health is everyone's business and that people from a wide variety of sectors have a role to play in improving a community's health. So throughout this work, it's important to continually communicate with your partners and policymakers, community members, and being able to effectively tell the story of what's working in your community. We also just want to review kind of some key foundations of the roadmaps, and the roadmaps really, again, look at taking everyone, all of us working together to improve health. We encourage people to move as quickly as possible from data to action and not get stuck in drowning in data or analysis paralysis. We encourage communities to look to the evidence to inform action, and if you innovate, make sure to wrap in some evaluation into your plans. Keep focus across the health factors, including social and economic factors, and don't be afraid to take on policy, systems, and environmental change that in the long run can help create long-term change in health for adults and children in your community. So some of you may have heard about the Robert Wood Johnson Foundation Culture of Health Prize, and I just want to acknowledge that this is a prize that honors communities whose efforts illustrate an enduring commitment toward creating a culture of health. Winning communities receive a $25,000 cash prize, and this slide lists the criteria that we use to help in the selection process for our prize winners. We're always looking for communities who can bring these criteria to life. This is a map that illustrates where our 2013 and 2014 Culture of Health prize winners are located. So you can see we've got a broad range of communities represented across the country. And the 2015 finalists were announced in February. And so keep your eyes and ears open for the 2015 Culture of Health prize winners to be announced this fall. So going back to our model, let's talk a little bit about the policies and programs that really impact health factors. What I'd like to do is bring you to another tool that shows you how communities can identify policies and programs and different strategies that they can use in their work. So before we go there, the What Works for Health database is an easy-to-use menu or easy-to-use searchable menu of different solutions, and you can select a health factor of interest and then browse through those evidence ratings for strategies that address a particular health factor. When it comes to developing and implementing solutions to problems that affect our communities, the evidence really does matter. And using what's shown to work can drive smart strategies and smart investments. None of us have lots of time, money, or resources to reinvent wheels and duplicate efforts. So choosing strategies that have been shown to work can really help you stretch the impact of scarce dollars and resources. And knowing whether the strategies are effective and can address your community's priorities can help inform those decisions about when to adopt an existing strategy or maybe when you need to take a more innovative approach. So it's important to understand what has been shown to work and what hasn't when you're creating solutions. So let's go back to the website, and I'll show you a little bit about what you'll find when you come to our roadmaps, to the What Works for Health database. So let's go to the Roadmaps for Health tab, and you'll see the link to What Works for Health here. So let's click on that. And again, this What Works for Health database provides communities with information to help you select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors that we know affect health. To learn more about the strategies that could work in your community, all you need to do is select a health factor of interest, these light blue boxes on the side, or enter a keyword in the search box. A feature that was added to What Works for Health last year is that now you can browse new policies and programs that were recently added. And this is a growing and ever-changing resource, so we're always looking for new strategies to include. This year, the What Works for Health team updated the Using What Works for Health tab to make it more user-friendly. And there's also some changes within the rating strategies. So let's look at one so I can show you what it looks like. Here's our model, and taking a look at the types of policies and programs, let's take a look at income. So I'm going to click on the income, And here we find 13 results. From here, you can filter your search by different approaches, by decision maker, or by evidence rating. So highest rated evidence, highest rated strategies and those that are rated scientifically supported tend to appear first. Evidence of effectiveness can mean different things to different people, and our approach to assessing evidence combines what we know from scientific study and the observations of unbiased experts. So each reviewed strategy is assigned an evidence rating based on the quantity, quality, and findings of relevant research. If you click on a strategy, and I'm going to click on, let me click on the Earned Income Tax Credit, you'll find the full entry for that policy or program, including expected beneficial outcomes. And new this year, other potential beneficial outcomes. The expected beneficial outcomes are those that the strategy is directly intended to achieve. But we know that some strategies have other impacts. So when the evidence shows that other areas are also positively impacted or may be positively impacted by that strategy, they're listed under the Other Potential Beneficial Outcomes section. Continuing to scroll down, you'll see evidence of effectiveness, impact on disparities, and implementation examples and resources when they're available. I'm going to scroll back up again because this example also has a community in action highlight, and this one highlights how Kentucky Youth Advocates is working on a statewide earned income tax credit. So you'll find these community in action examples sprinkled throughout the What Works for Health and the Action Center. If you hover over this ratings thermometer, you can see the definitions that we use for all of our 6 ratings. You can learn more about ratings and methods from the left navigation bar on the main What Works for Health page. So finally, we know that communities learn so much from each other's successes and challenges, and I want to just show you how you can learn from others by coming to the Roadmaps menu and clicking on Stories that highlight sections or highlight examples of communities that are taking steps to improve health across the nation. Sorry, that's not staying highlighted for you. We also have some awesome national partners that can help you engage with other partners and leaders locally, and you can learn more about our United Way Worldwide and other partners across the nation. So as you can see, that Roadmaps provides step-by-step guides and tools and resources. I just want to come back to the next slide I wanted to show you that summarizes this very important message that where we live really does matter to our health. We know that there are great disparities in health based on where we live. We also know and firmly believe that health is more than health care. Health is more than just what happens in the doctor's office or in clinics, and that many, many factors contribute to health. We are all in this together, and it takes all of us working together to improve the health of a community. Sometimes communities find themselves stuck, or they may need some guidance, and this is where the Roadmaps to Health coaching can really provide local leaders anywhere in the country with direct support from community coaches to help strengthen their capacity to advance health in their communities. Again, this section can be found under the More tab, and then clicking on About and Roadmaps to Health Coaching. So thanks to the support of the Robert Wood Johnson Foundation, coaching is available at no cost to communities. And this service provides guidance in how best to strengthen partnerships, how to enhance skills in a very strategic manner, or maybe helping a partnership or coalition navigate challenging policy advocacy choices. So we have nearly a dozen community coaches who work with communities in a short term, maybe 1 or 2 phone call capacity, to long term, up to a year of monthly coaching. And most, if not all, that coaching is provided through distance learning technology or phone contact. So there's a couple of different ways that you can request coaching. The easiest way is by contacting us through that Get Help box that is on every page on our website. So now let's see if we can answer some of your questions. I've been talking quite a bit, helping you to learn a little bit more about our site. And Mary, do we have any questions that we can help address?
Thanks so much, Stephanie. We do have a couple of questions here. And one is, how do you determine the weights for the different health measures?
Great question, Mary. And some of you may have recognized when I was on the screen that talked about the various health factors, health behaviors, clinical care, social and economic factors, physical environment, and the health outcomes measures, that they carry a percentage. And this is what we consider the weighting of those measures. And I can tell you that there is no one correct formula or really true set of weights that perfectly represents the health of a community. And even a really good system by today's standards might not perform well over time or under all possible circumstances. So our county health ranking staff has used information from a wide variety of sources, things like the literature, the scientific research, available data, expert opinion, statistical analyses, all of those, to arrive at a set of easy to understand weights that reasonably reflect the different components and determinants of health. Of course, we know they're not perfect, but we believe that they're really good estimates supported by the best available evidence, balanced with the availability of health data and their ability to be interpreted.
Thank you so much, Stephanie. Another question has come up in terms of how can communities use county health rankings to focus on a specific topic, such as tobacco control, poverty in older adults, infant mortality, or obesity?
Thanks, Mary. Well, you know, there are a lot of different ways that communities can use the county health rankings and roadmaps to help focus on a specific topic. You know, one place to start is looking at the data to really help you understand how your community is doing. Again, the county health rankings is a snapshot, and we encourage communities to look locally for data that may be more up-to-date or that really helps to round out the picture in your unique community. We encourage communities to go to our Action Center to find tools and resources that really help move them from data to action. Again, we don't want you to get stuck in drowning in data. We want you to quickly move from data to action and to try to implement policy systems and environmental strategies to improve health in your community. I just demonstrated the What Works for Health database, which is a fabulous place you can go to learn about evidence-informed strategies, different policies and programs that you can implement in your community. And I always think it's a great idea to see what other communities are doing. And we've sprinkled those communities and action stories throughout our site to help you kind of link with knowing what's working in other communities, as well as look to those prize-winning communities. Those are just fantastic examples, and I find them really inspiring to share with other communities to say, here's what's possible. So those are some ideas.
Thanks again, Stephanie. And we have another question here. The person is asking, what are the most meaningful measures to improve community health?
Oh boy, the most meaningful measures. Well, I believe that all of our measures are meaningful, and I especially find meaning in those social and economic factors, those upstream factors, because those really can help identify some significant, I guess, gaps in opportunity that tend to disproportionately and negatively affect populations like our English language learners, or folks who have lower incomes or maybe limited education, folks from ethnic minority communities. So I just want to acknowledge that social and economic factor category carries a weight of 40%. I think it's important to be mindful of how all of those factors are important in influencing how well and how long we live. But I wouldn't say any one is more meaningful than the other. I think they all carry a specific and unique meaning. Those social and economic factors just happen as a group to carry a higher weighting.
Thanks again, Stephanie. Another question that has come up is, how can one county that's very similar to another county be so different in the rankings?
Well, again, there are lots of possible answers to this question, and a couple of thoughts that come to mind is those counties may have differences in the size of their population, and so the rankings may be a factor of the size of that population in the county. Rural counties look a little different sometimes from counties where there are more urban settings. There may be a significantly higher premature death rate, and because that measure accounts for 50% of the health outcome ranking, that can have a significant contribution to a difference in rankings. So one of my suggestions to communities is to use the rankings as a guide and a starting point in the conversation, but then really look to the data to help you understand what might be the unique and contributing factors to the health in your community. And working with community partners to help you drill a little deeper at a local level is always recommended and encouraged. So collaborating with folks at your public health department, folks with your hospital that may be doing community health needs assessments, collaborating with folks at the United Way, lots of different possibilities and partners to collaborate with.
Thanks again, Stephanie. And we do have another question, and the question is, are there new measures used this year?
Yes, we have one new measure, which is that income inequality measure, and that is found in the social and economic factor category. Again, this is a measure that I think of it as representing the divide between the poor and the affluent. So it's really a measure between the gaps between the poor and affluent in our community. What we use is we look at a household income at the 80th percentile versus household incomes at the 20th percentile. And the greater the income inequality measure, the greater the gap between those with more affluence versus those who are poor. So the other measure is a measure that actually replaced a previous measure, and the new measure is called social associations. And that is a measure of the number of civic groups or associations that are available in a community. So things like clubs and civic groups, membership organizations, Rotary, just by way of examples, things like that. So I know that in the 2014 County Health Ranking release there were several new measures. This year in 2015, the one new measure is income inequality, very important measure, and then the measure of social associations is a replacement measure of family and social connectedness. So with that, I appreciate all of the questions and would like to encourage you to check out our upcoming and archived webinars. You can go to our countyhealthrankings.org site /webinar. Mary's just chatted out that link now. This webinar that you are listening to today will be archived, so if you have colleagues that you think would benefit from listening to this webinar, you can check back on our site and we'll have the archived webinar available for you. But check back frequently as we are continually adding new webinars. We also hope that you'll stay connected with us and use your social media to stay in touch and communicate about the County Health Rankings and Roadmaps program. So you can follow us on Twitter, you can like us on Facebook, and subscribe to our e-newsletter by emailing us at chr@match.wisc.edu. So we hope that you feel inspired to reach out and take that next step wherever you are in your journey toward building a culture of health. And we hope that you join us in the future. We hope that you found some helpful information that you can use in your community. Thank you so much for taking time out of your day to join us, and we look forward to hearing from you in the future. Thank you so much and have a great rest of your week.